So I'm glad that you're all able to attend for this month. So we can get started. So, and so again, as I mentioned, thanks for joining Miss Women's History Month. Yay! So please introduce and tell us your name, your organization, and who is the most inspiring woman in your life, and what did you learn from her? And if someone would like to come off of mute and start, you may do so. And please, if you don't, just add it in the chat. And anyone would like to come off mute and share who's an inspiring woman in your life? No one wants to share?
I'll
I
do
can
it.
go. Oh,
No,
go
oh,
ahead,
please,
Judy.
no, please, Caitlin, go ahead, please. I didn't want to leave you hanging, Ternisha. Please go ahead, Caitlin.
Great. I was just gonna say, so hi everyone. I'm Caitlin Murphy. I'm with the health department. Caitlin Murphy Ladelma. I'm still getting used to that third name.
Mhm.
With the health department, and I would say that my an inspiring woman that I learned a lot from is my little sister, who is just like through all of life's up and downs, she has this ability to like always have like perspective and like be grounded and have like internal peace, and it's just something I really admire about her. So I would say I learned from my baby sister.
Oh, so sweet. Awesome. Thanks for sharing, Caitlin. Okay, Judy.
I'm gonna say my mom. My mom was a very we called her the little general, or my husband called her the little general, but she was very inspiring. She worked for the federal government, specifically NSA, for 42 years, and she learned the Russian language, and she did things that I have no idea. But and you guys, this is fascinating to me, even though because she passed from Alzheimer's at 91, but even in her Alzheimer's, she said nothing, absolutely nothing about it. So, they trained her well, and it's taught me a lot about, pushing through, even though you're tiny and people don't think much about you because you're so tiny. She didn't let that rule her. So,
Awesome. Awesome. Well, thanks, Judy, for sharing. Sharon Gibbs Cooper also said her mother, she's resilience and perseverance. And Jay also mentioned his sister, who is very fearless. Thanks for sharing. Um, yeah. Tell if you want to go to the next slide. So today we just did our welcomes and introductions, and I see people are still putting their names in the chat. So thank you so much. And if this is your first time joining us, please you can come off of mute and introduce yourself. And the ones that's been here several times, thanks for continuing to join and continue to put your name in the chat in your organization. So any newbies that would like to come off of mute and introduce themselves?
Good morning, everyone.
Good morning.
My name is Krista Smith, and I am one of PG County Health Department's newest intern. And I'm excited to be here. I've been learning a lot. I've been contributing, and I'm really excited to share in the planning and outcomes of our health in the community.
Welcome, Crystal. We're so glad to have you. Thank you.
Thank you.
Anyone else? Okay, welcome again, everyone. So we'll get right into our planning discussion. And before we do that, of course, we want to just always go over our vision and mission. So the vision, Prince George's County of the CCT committee is Prince George's, well, work group, I'm sorry. Prince George's County is a place where everyone has access to high quality and effective healthcare services that are well managed, seamless, and tailored to their specific needs. And our mission, empowering healthier lives through efficient care coordination with a strategic systems approach. And so now I will turn it over to either Taylor or Dr. Carter, who will give a recap of our February meeting.
Thanks for welcoming us, Tornisha, and welcome everyone. Thank you so much for joining this March meeting. Excited to continue our discussion from our February CCCT meeting. At that meeting, we had a very open conversation. It was it wasn't a recorded conversation, so I wanted to share with you all the notes from our last meeting, some of the sentiments that were shared. In our last meeting, we discussed some public health challenges that we are seeing that are emerging here in Prince George's County, especially from the national level changes that we've seen. The changing public health landscape looks very different here now in March, almost April, than it did in December, January of this year. And so we wanted to have a sit down with you all, being out in the community and working with different subpopulations in Prince George's County to understand the challenges that you all are seeing and to situate ourselves as a CCCT to learn more about how we need the actions that we need to take in the next few months in response to this public health emergency and the challenges that we are seeing in the community. So we thank everyone for your feedback in our last meeting. We're going to do a brief recap, see if there are any new sentiments that anyone would like to add or anything that we may have missed in that meeting summary. And then we're going to transition our discussion to taking some of those sentiments and seeing what our next steps are. And again, what actions can we take here and now as a work group to respond to those challenges and to see how we can best support our community at large. So in our last meeting, we asked folks what new or emerging challenges have we observed in our community that require our attention. Many folks uplifted the changes to our immigration policies at the national level and the impacts that they are having in our local communities. Being that this is the CCCT, I am not surprised that we brought in several sectors into our conversation. So folks were talking about the implications of immigration policy changes on our school systems, on our public safety systems, our criminal justice system, and the implications that we are seeing there in terms of our schools. Folks shared that students may be kept at home or their families may be scared to send those students to school due to these sweeping immigration policies for our communities here in Prince George's County. And what impact does that have on the quality of education that students are able to access and have equitable access to here in Prince George's County? We talked a little bit about public safety concerns. As uncertainty increases in our communities, we oftentimes see more acts of violence or more crimes. We see crime rates increase. And so what does that mean in terms of maintaining public safety here in Prince George's County? Also, that relates to our criminal justice system. When we are talking about challenges with recidivism, what does that look like in uncertain times? And how can the CCCT intervene to really make sure that we are implementing multi-sectoral approaches that disrupt that system and take into account all of this feedback that we are receiving and are able to coordinate across all of these systems to create a multi-systemic change to address the challenges that we are currently seeing. The CCCT, you all uplifted an overall erosion of trust. We know that this has been a historical barrier to accessing care, not just in Prince George's County, but in many of our communities. And, being against that historical mistrust, now that we see sweeping policies that are especially impacting folks' access to care and access to safe care, we see an erosion of trust at an increasing volume. And what can we do to reestablish that trust and to be able to assure folks that they are going to be safe and still have that same access to healthcare that they had before we've seen some of these policy changes go into effect. And as a CCCT, again, we're looking at the healthcare and the care coordination systems. We know that it doesn't just end when someone goes to the ED and gets that Band-Aid on a bullet hole. We need to be able to coordinate their care after they visit in the ED. And so we need to make sure that we are able to uphold the trust in the community to be able to access those healthcare resources, but then also several of those resources that folks access to address their social needs.
some of our federally qualified health centers who are on the line. They shared with us challenges and lasting impacts that policy changes will have on access to reproductive care, and folks who continue to see reproductive care with throughout their pregnancy and post-pregnancy, and also access to gender affirming care. We heard from a FQHC who expressed a long waiting list, and folks were finally getting through those waiting lists to be able to access those gender affirming care options, or to be able to have access to some of those referrals. And due to policy changes at the national level, there's been a significant barrier put and cuts off their access to gender affirming care resources. And so, how again are we navigating that change? And again, creating these open communication channels so we can stay connected with you all to find out about these challenges as they are occurring in our community. And so that led us to, our final sentiment. As you know, Dr. Carter, he finished up our last meeting and he really emphasized the requirement for a systems level approach to create and develop private and public partnerships to address the entire continuum of care. So again, addressing folks who are, looking out for specific healthcare needs, but then also in this care coordination system. And what does that look like for us all on the call? What challenges are we seeing, and how can we come together to again develop a systems level approach to address the emerging challenges that we are seeing? And so with that being said, I want to go ahead and open up the floor. If anyone had any other interpretations from the last meeting that we didn't capture here, or if they had any new sentiments that they wanted to share, again, talking about any new emerging challenges that we may have observed in our Prince George's County.
This is Jay from the Department of Social Services. I'll jump in here. I'm not sure that this is an emerging challenge. But it's something that we recently observed, that there are competing incentives when we're working in the homeless system, when we're working with healthcare providers that are potentially for-profit institutions, and that some of the incentives don't necessarily align with best practices related to housing. We had a situation where somebody that was at a rehabilitation center, like a skilled nursing facility rehabilitation center, was just exited to homelessness, like exited from the street, exited onto the streets because they were no longer medically qualified. They had been determined to be medically stable, and that the reasoning that was given to us was that if they kept this person one more day, the organization itself would lose the $40,000 that they were entitled to be reimbursed for his care, because the entire length of his time in this facility would have been determined to be like invalid somehow if he had stayed one day extra. We were trying to come up with, he has a referral to a permanent housing location. And we had to temporarily put him in a somewhat inappropriate placement in one of our emergency shelters, because otherwise he would have just been out on the streets. So again, I don't know that this is there's lots of conversation that we could have about this. Like the street outreach manager and I were having a conversation this morning about whether anybody in Prince George's County could have the juice to tell an institution, like, you can't exit this person if their accounting department is telling them that they have to. Like, I don't even know that if Dr. Levy had called up and said, you have to keep this person in the facility, they might have said, take it up with our lawyers, right? Like, I don't know that there is anybody who has the juice to stop things like that from happening. But the competing interests between at least a semi for-profit healthcare system and human well-being.
So Jay, that's our continuous struggle. The struggle between the public good and the drive for profit. I mean, we don't have, it's that's it was probably um it's very is it's very clear that we need something in between. We need some type of hybrid
Yeah.
agent governing body,
Yeah.
because local government won't do that. I mean, it's a long, arduous process to even get the legislation, blah 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 blah.
Yeah.
And I don't have enough years in my life to live that long. So what I think, one of the things that I'm advocating that the CCCT and what we ultimately do is to create that that entity. And
Hmm.
I don't, believe me, I can't tell you all of the parts of it. So when I say a systems level approach,
Yeah.
meaning that here we have a system that has two big competing goals: the public good, and then you got the private sector, the big gorilla in the room, the hospital system.
Yeah.
There has to be, but our system wants to increase the overall health outcome
Yeah.
of anybody. So,
Yeah.
and this is a classic example how those two systems, when they compete, the private side wins, the public good goes down the drain.
Yeah.
So somehow we've got to create so to create a system that actually can output a improvement in the health, we have to have something else in the system
Yeah.
that will help us do that. And our approach in the CCCT is to develop that.
Yeah.
And that entity has to be sustained by something other than the government, because it's got to be bulletproof to the government. And it has to be bulletproof to the other competing entity, which I can't tell you how that would work.
Yeah.
But
Well, I know that.
typical, go
Oh, I'm
ahead.
sorry.
Go ahead.
I was just going to say, I know that there's really good work that's being done right now to address that particular need, right? The development
Mm-hmm.
of medical respite, and
Mm-hmm.
that is a public-private partnership, right? Like
Exactly.
and
Mm-hmm.
so I think that there are efforts to create the systems that can mitigate when we identify that there is a
Right.
gap that people are falling into. I think that
Right.
is happening. I just wanted to highlight that it's still an ongoing struggle.
Yeah, and but you pointed out well that one thing we have to try to build is these public-private partnerships that can do it. Like you said, there are public-private partnerships that actually address these problems. They what we want to get it to scale. That would be and make sure that it addresses all needs so that we can lift all boats. We don't want, we can lift a few boats. No, we have to be able to lift all boats. And because a lot of these things are targeted, they're sort of like they target specific things. But a systems approach would be to make sure we can address all needs for all people and have the standard infrastructure that can do that. I'm not saying that that's something easy to do, but I appreciate you bringing that up, because that's exactly what we have to do. Whether Because there's, of course, with our immigration policies and the things that are going on with that, we still need a structure to help our people to lift those boats, or our homeless people, or our people with food insecurity, or people who just can't even get to the doctor. So we have to figure. I'm not saying that we have the solution, but I do know we're going to try various solutions. The CCCT is to in Prince George's County. When I say CCCT, I really mean it's in Prince George's County. I believe the CCCT, along with its partnership network, can ultimately do at least try something that we might be able to scale.
Hello, it's Ebony. To the situation, far as the individual who they just threw out the healthcare facility, um, was social services involved? Did they have a bondsman specialist that was working to help that individual before they just toss them out and put them in the homeless situation?
I'm not sure what you mean by bondsman.
It's a
The Department of
Ombudsman is the people who
Oh,
actually
ombudsman.
advocate,
Yes.
that advocates for the individual before they're even tossed out. And even in
Yeah.
that process, before them being discharged, was anything set up for a homeless facility that will take care of their medical needs?
Yeah. Excellent question. I'm not aware of an ombud at the rehab facility, and I work for the Department of Social Services. Our homeless response system had been involved with him. He had been in an emergency shelter before going into the hospital and then going to the rehab facility, and actually has a pending placement into a permanent supportive housing program for people who are experiencing homelessness. And so, yes, the homeless service system was very involved. In trying to mitigate the fact that he was being exited to homelessness. The question is whether the healthcare system can prevent him from being exited to homelessness. And I
Yeah, they
think,
can. They can. They could have switched them to long-term care. And all they needed to know was if he had any finances.
yeah, they might not have wanted to switch him to long-term care because he wasn't going to be there long term. He had a placement elsewhere. But yeah, this to my knowledge, there was not an ombud within that organization that was advocating on his behalf, which, as I understand, the sort of role of an ombud is somebody that's in the organization itself who's advocating for like a particular client or a particular class of clients.
Okay. Okay, because it was different routes for that, but it is a good thing that the homeless services are a part of whatever is going on with that individual. But there was different things that the facility could have did before they actually pushed them out.
I think that was our impression too, but
Mhm.
those steps were never, I guess, suggested or taken by the facility itself.
Okay, thank you.
Excuse me, I have a quick question, and my lack of knowledge. If was the facility that the patient was being exited from, was it owned by the hospital too? Is this a health system?
It is.
Okay.
It was. Yeah, it was owned by a healthcare. It was a healthcare facility.
Okay. Only reason I'm saying is that I don't think hospitals are allowed to do that, but many times what they'll do to save themselves money is that they at least when I worked for hospitals, we weren't allowed to do it. But they many times will then discharge patients to a lower level of care even within their organization, because the not lower level of care, lower level of cost is what I need to say. I'm sorry. So that's what they'll do. But I don't know if there's a requirement from the other kind of facilities that they can't exit a patient. I don't know that. But I do know I do not believe a hospital itself is permitted to do that.
Were there any other reactions to the challenge that Jay brought up, or any other challenges that folks wanted to lift up from our last meeting?
I think one challenge that we're starting to see, but we might continue to see is the impact of the federal layoffs. I know that federal employees tend to have, a bit more, I think, savings and stuff like that than maybe the general public, or more like uh lower wage workers. But it's going to be a rough time to be unemployed and sort of in that federal type of work. Um, I know they announced another, like, I think 10,000 employees are getting laid off from HHS agencies. this morning. So I do think that's going to start to have, like, we're going to start to see those impacts within Prince George's County, especially because we have like 30,000 federal workers who live in the county. Um, so yeah, I'm not sure if anyone has like started to see that already, but I would anticipate that that's going to be something that comes up also, like a whole new population who might be struggling.
I'm glad you mentioned that, Caitlin. Actually, I don't know if we have any members on from our behavioral health advisory group, but they convened last Wednesday. And when we had a very similar conversation about the emerging challenges in the community, many of our clinicians and mental health providers were talking about that they're seeing elevated cases of stress, anxiety, depression in relation to the uncertainty that folks are experiencing, whether it be due to job loss or policy changes, anything that's happening from national decision makers. And they were also discussing how now more so than ever they're being asked for resources related to the social needs, and so they're having to field calls during sessions about rental assistance and homeless services, if it were to come to that. So something that behavioral health hasn't, traditionally been in that continuum of care, but now they're kind of being thrown in the deep end of having to, answer some of these questions and having to coordinate more with more of our agencies and more of our partners across Prince George's County.
Yeah, and that's going to be so rough, right? Because we already know in Prince George's County, we don't have enough resources for the populations that are already in need. So if we're adding, I think the downstream effects are also going to be felt because all those federal workers send their kids to daycare at Prince George's County facilities and, you know, shop at Prince George's County, like clothing stores, and all of that is going to, I think it's just going to be, I think we're heading into an economic time that is going to add a whole lot of people to our resources that are already gone, like depleted. There is no emergency rental assistance, really, that's available. I mean, that's what we hear from the community health workers all the time. They're like always trying to refer over. The housing voucher list is like so long and all this. We just don't have the resources in the county. So I think it's going to be, it's going to really be increasingly difficult.
Yeah, the Metropolitan Washington Council of Governments has a work group called the Regional Care Coordination Learning Collaborative that I co-chair, and we had our monthly meeting a couple of days ago, and it's made up of homeless continuum of care representatives from all 9 of the jurisdictions of the COG. And we talked about this specifically, that there's been an increase in people seeking information about emergency rental assistance, homeless services, and specifically people who have never accessed those services before. And one of the things that that was clear to us is that was at least the uptick that we're seeing is related to the layoffs of federal workers and people whose jobs have been impacted. Not just the layoff of federal workers, but the disruption to federal funding, which has then had the impact of affecting organizations that, any position that's funded with a grant from the federal government, like mine is, those have been significantly impacted. So there's been a definite increase in the number of people that are seeking homeless assistance and rental assistance for the first time and have never accessed that system before.
And I am curious, just pivoting really quick, we were talking in our health equity work group last week about the budget, and that's another situation that we are going to present an emerging challenge. Dr. Cooper, curious if you wanted to share any sentiments about what the work group is moving forward with as it relates to health assures, and invite any folks on the call to join that effort.
Well, excuse me, we've been talking about advocacy, that particular component as a priority to be able to understand the budget of course, advocacy and meeting and writing our legislators to let them know what's important and to also express through the lens of the community what's going on and keep them apprised of those particular issues and, of course, how things are interconnected. When we talk about layoffs, we talk about the implications that it is to not only the healthcare system and that strains social services, access to, other services such as employment, education. So we're looking at that interconnectedness and trying to, sort out solutions to be able to address those particular gaps and try to position ourselves to be able to look at, as Dr. Carter had mentioned earlier, public-private partnerships and striving towards the area of collaboration, because we all know once we harness and leverage our resources, then we're going to be better postured to be able to identify resources that are stretched. Which, at this point, we're looking at competing priorities. And so how do we work better and smarter? So that's where we are with the work group. And I think I summed it up. And Taylor, anything I missed, please feel free to add to that.
Thank you, Dr. Cooper. And just really quick for folks who may not be aware of Health Assures program, that is a program that supplies funds to our federally qualified health centers to best serve and see our uninsured residents here in Prince George's County. With the proposed budget, I believe funding is going from $4 million to about $1 million. And so the Health Equity Work Group is specifically looking at mobilizing some Prince George's County residents to write a letter in support of at least maintaining the funds that have previously been allocated, or trying to see what they could do to increase funding opportunities to keep Health Assures up and running, because we know that that is a very, very important program here in Prince George's County and serves many, many residents and assures that folks have really baseline access to healthcare. So anyone who's on this call who would be interested in hearing more about that effort or contributing to any of those advocacy efforts, please feel free to put your email in the chat and I can coordinate us all offline. Were there any other emerging challenges that folks wanted to bring up or elaborate on from our last meeting? I know we have some of our federally qualified health centers on the line today, so not sure if you all want to give any updates or share any challenges that have come up since our last meeting. And another point that we mentioned in our February meeting, doing a really quick scan of what our community partners and agencies doing to protect Prince George's County's most vulnerable populations. So really focusing more so on our immigrant populations in Prince George's County. I believe Mary Center and La Clinica, they were talking about providing resources and documents to uphold clients' rights as they are seeking out medical services. So highlighting those HIPAA and constitutional rights, providing ICE-specific ICE-specific questions and procedures for medical staff when ICE officials are trying to enter medical spaces, so medical providers can understand clients' rights and what they should say and what they should be looking at. For example, in a subpoena, what information they should require before discussing any access to a facility where a client may be visiting. Also discuss paperwork for families to protect their children and outline steps for childcare if ICE were to take the parents, if they were to be removed from the home, to ensure that those children are still taken care of. Were there any other resources that we wanted to lift up in terms of our immigrant populations, any best practices that anyone's seeing, or any resources that they've been sharing from their organizations as it relates to providers or any resources in the community to best support our immigrant communities?
I know, Tella, this morning I saw on the news, ICE had went to the schools, if I remember correctly, and tried to arrest a contractor that was working, but they wouldn't let the ICE into the facility because they didn't have a warrant. So I was like, ooh, maybe that's something I didn't know, or and I don't know if others knew, like, that's probably something others can use, like if they don't have a warrant, ask them for documentation before they let them into the facilities.
And I'm curious, Tara, I know in our last meeting, you talked a little bit about some of the resources that Mary Center is using to educate both the providers and the clients who are seeking services. Have there been any updates to some of those resources? Are you seeing any gaps that we could help fill in terms of the materials that you all have, or are there any best practices that you could share with us?
Hi, hi and good morning. My name is Tara Pavo, and I'm the Director of Social Services at Mary Center. We continue to do a whole lot more of the same, right? We continue to provide presentations and education about, client rights, people's rights, and so we've recently had last Tuesday, two Wednesdays ago, a presentation from the Children's Law Center to educate the team in regards to, because a lot of the folks are, our immigrant community are really worried about, the deportations and what will happen to my children and what will happen and what will happen. So we had a Children's Law Center presentation to provide us with forms and materials about, powers of attorney, custody documentations, things like that to help, just to educate the community and just to provide these resources. So yeah, so we continue to do more of the same. We continue to host and educate both clients and staff, and to prepare. And also one thing I also want to note too is yes, we've been seeing a decline with folks coming to our health clinics, folks seeking our school-based mental health services, students even going to school. We've been seeing such a decline to that. But one of the things we've really been, you know, regardless of what these executive orders are, you know, I want to say ruining, but I'll say ruining. Regardless of what these orders are ruining, it's like goodness gracious, HIPAA is still in effect. Please come to your medical appointments, right? Like please, because regardless of, these warrants and whatnot, HIPAA is still in effect. And going to your doctor's appointments is really important. So that's also what we are encouraging folks, that you are safe in medical rooms, you are safe behind these doors. So please keep coming to your appointments. And yeah, and we just keep doing more of the same because education is power. Thank you. Oh yeah, there you go. Look at that. It's as if like I did the slide. You knew what I was gonna say. Family preparedness plan, yes. Know your rights, yes. Yeah, beautiful. Thank you.
Yes, thank you, Tara. I think, what we shared in our last meeting is we have, and this is, a common theme in Prince George's County is we have, so many resources, so many organizations are working on all of these great resources. And sometimes it just requires that common thread to bring all of those resources together. And so maybe if Mary Center has this really great resource and then this organization has another really great resource, we can hopefully bring it together. And so we can fill any gaps and hopefully address, we understand that people are working in overdrive right now. They're in this mode where, they're having to create materials that may not have been traditionally out there. And so they're having to, find and locate these resources. A lot of times, I did a really quick environmental scan after our last meeting, and some are blocked by paywalls. And so there are barriers to just being able to access this information. And so wanted to propose to you all today, what would a toolkit look like if we were to work with all of our partners on the call, do some continued outreach to other community partners to hopefully bring all of these resources together to have in one place, and kind of what would we want to see out of that toolkit. Tara, I see your hand raised.
Yeah, thank you. And I also wanted to add too, and it's bringing back our last meeting, and the direction that Mary Center is educating our team, like in case ICE comes to our clinics with an administrative warrant, and it's really important to educate. Administrative warrants versus judicial warrants, and as well as like what constitutes public spaces, right? Because it's administrative warrants that they're presenting for the most part. And what constitutes a public place, right? Because you can be in our waiting room, but if I go to the bathroom in my waiting room, is that a public place or is that now a private place? And so those are the kinds of questions that, it's we don't know, right? And providing the opportunity to educate your team and really be specific on what this means. And that's when we were asking questions about, okay, but this is our waiting room and this is our, public space. But what about the doors that require like badge entry, right? Is that also considered public space, or now are you going into like a HIPAA protected space, And so that's what I wanted to share too, and in the education and the directors from our executives to our team. But we're also being careful because if you've been paying attention to some of the news, like agencies that do that to prepare their teams to, in case ICE comes, this is within our rights to do. But sometimes those messages get leaked right out into the community, and it gets spun or twisted to be like, see, you're not, you're up against you're not following orders kind of thing. So I just wanted to say that with the delicate, what do you say, the delicate hands on, on sharing the messages, because it can get so twisted if it gets leaked. Thank you.
Thank you for bringing that up. And I see Liz has put in a toolkit from CASA, a Know Your Rights toolkit specifically. So I think that's really kind of capturing the essence of bringing together all of these resources to have them in a localized location. And so folks would be able to access, for example, I'm thinking of our community health workers who may be in the community, or even down to our behavioral health providers who may be seeing specific clients who these resources may be helpful to. So I'm curious on the line, any of our CHWs who may have been experiencing clients in the field. I know in our last meeting, we were talking about how to innovate solutions and really emphasizing the need to meet people where they're at. If folks aren't, going to, if they don't feel safe accessing clinics, meeting them where they're at in the community. So curious if there are any specific resources that our CHWs would want to see in this toolkit that would make their lives a little easier, or again, would best support the clients that they are seeing. And I see Liz.
Hello. Um, okay, there I am. Okay, so yeah, so CASA, I did post it. I did share the link to the CASA Know Your Rights Toolkit. Our legal team prepared it. It also has these little cards that you can cut out and give to the community members so they know if they unfortunately are involved in some type of raid that it tells them specifically what to do. The toolkit is in English and Spanish. We have trained our community members um, to be vigilant, to have these cards with them, to give them to the community members. CASA has also restricted areas within our own organizations to where someone mentioned, like, if they go to the bathroom, if someone comes to our organization and they go to the bathroom, anything outside of the normal lobby within our organization's buildings is private area. So they will not have access to anything like that. um, and just getting the buildings prepared and stuff like that, authorization, personnel only, that kind of thing is what CASA has done. But as far as our uh, community health workers, we train them. We talk to them about the excuse me. I'm not feeling too well, so I think my medication is kicking in. Um, we talked to them about how to talk to community members regarding their rights, of course, to go to the doctor's office. We're advocating legally for, even though federal rights, executive orders have been in place. CASA has put a lot of lawsuits into place to protect their rights. We do enforce their medical rights as far as patients' rights, and just continue to constantly educate and reinforce is basically what the community health workers are doing right now more than anything, because people are scared. They're really scared.
And I have a quick question, Liz, and I do on the cards it says like you have a right to speak to a lawyer, contact a lawyer. Do you guys also have lawyers in place so they know who to contact? How do they even get a lawyer?
So yes, if you go to the link that I put at the beginning before you get to the toolkit, that 1-800 is specifically for ICE activity. Um, and anytime something has happened, we've had community members contact them, and a team, if they can meet where the people are at. If the raid is still going on, then a centralized team with including an attorney shows up to that location. If the raid is over, then it's more of a support to the family members who this has happened to. But yes, there are attorneys available.
And I know I was on a call a few weeks ago. Actually, it was a recorded session that was streaming, but it was from our library system. They had some of our resources come on and talk about some of those free attorneys and who to call, if you're in those situations. And they had a beautiful graph of, if this, call this, if that, call that. And so again, would love to create a centralized location where we have all of these links, all of these resources available. So again, if someone is in that situation, it doesn't have to be a situation where they're going and having to look for all of this information. It can be in one place as folks need to access it. But Liz, I would love to chat with you more to understand, any additional resources that your CHWs need that we could help locating or help get together in this toolkit.
Absolutely.
Great. And just following up on our discussion from last month, are there any other resources that folks would like to see in a toolkit or anything else that we should consider as we start researching?
Hi, I'm sorry if I had missed this, but like just as a suggestion for additional items in our toolkits are forms in regards to like power of attorney forms, like those kinds of fillable forms and emergency forms, like, well, that would be individual, but that's just something that just came to my mind is, the forms and where to access these forms and where you can go to get help for, power of attorneys, custody, finances, things like that. I can I'm gonna double check the forms that we had received from the Children's Law Center and share that with the team. And I can email Taylor and share that. Thank you.
Thank you. Yes. So we'll have many conversations offline about coordinating resources, sharing what we all have put together again for it to come under, hopefully one umbrella that's easily accessible. But again, in response to what we heard, we wanted to offer this up as a resource for, everyone on the call to see how can we, build this out in the next few months, have direct access to it and continue refining it as we go along and as we start to see new challenges. So have this in the back of your mind as you start to think about things. We're going to continue, of course, talking about some of those systems level changes that we want to implement, but we wanted to make sure that we were being receptive of the feedback that we heard from you all in our last meeting and that we were addressing it with this resource. So please let us know if you have any ideas for refining it or how it can best serve the community that you serve specifically. All right, and we will go ahead and jump into our community announcements. We have several links. So I'm going to go ahead and drop those in the chat. So first, we have the Summer Youth Enrichment Program, which offers Prince George's County youth ages 14 to 24 a professional development opportunity over the course of the summer. So the students will receive a $500 stipend, and they can be placed, they have a range of folks who are offering positions over the summer from July 1st to August 8th. So any students who please send them that application link. I've provided it in the chat. The deadline is coming up fast and furious on us, so please note that deadline for application is March 31st. And this opportunity is available specifically for Prince George's County youth, but there are other SYEP programs across the state. So if you just Google Summer Youth Enrichment Programs in Anne Arundel County, for example, Montgomery County, you can find opportunities in other jurisdictions for students who may reside out of the county. But please do share this with your resources and with your networks, and this resource will go out in our meeting notes. Next, the health department is happy to announce that the community resident survey is live. So the community resident survey is a really important piece of our community health assessment. We are asking the community to list their barriers to care, what they believe the county is doing well, and what we need to improve moving forward over the next few years as we develop our community health improvement plan. So if you can please share this survey with your networks. The deadline for completion is Sunday, April 6th. The survey is available in English, French, and Spanish, and those flyers are also available in those translated languages as well. So I will be sure to get those flyers out to you all if you can share it, and it has a QR code for folks to take the survey. Next, Luminous is hosting a celebration to celebrate 50 years of serving the Prince George's County community with a community baby shower taking place on Saturday, April 12th. I have put the registration link in the chat. I'll be sure to share this flyer with you all, but it is taking place from 12 to 4 at Doctors Medical Center in Lanham. Next, I alluded to this earlier, but there was a recorded community conversation about immigration resources. So specifically, the AMICA team came to talk about resources to serve Prince George's County residents. Those conversations took place in English and Spanish. So I put both of those links in the chat, and we'll be sure to share those in our meeting notes as well. But please go back and view those if you are interested. Share those, of course, with your networks. And we hope to host AMICA very soon to one of our monthly meetings to hear more about their resources and, again, increase our awareness to be able to share these resources out with the community. And lastly, something that has come across my radar, I don't know if other folks use this resource as much, but I know I have used it across my personal and professional journey. Is called County Health Rankings. So they did let us know that they are losing their funding at the end of next year. And so they are currently building their case of the use for County Health Rankings and how important it is to consumers. So if this is a resource that you have used and wouldn't mind taking a very short survey, again, just to talk about your use of their data for your organization. I've put that link in the chat. It'll be a very helpful tool for county health rankings to be able to leverage and apply for additional funding moving forward to hopefully keep this resource alive and accessible to the community. And with that being said, I want to quickly open it up to any additional community announcements or upcoming events. Anything anyone would like to share or that we should keep our radar up for? All right, well, Tornisha, Dr. Carter, I will pass it back over to you to close us out.
Thanks, Taylor. So thanks everyone for participating. And thanks for sharing the links in the chat, Liz. And also thanks Sharon Tara as well. So we're really excited about putting together the Immigrants' Rights Toolkit to leverage on what you already have in place and just making sure that we can help the population in Prince George's County. I think will be very beneficial. So Taylor and the rest of the team will be following up to get more information and to make sure we capturing the important information that's needed, and always looking for feedback. So you can reach out to me or Taylor to provide additional information or resources that you may have prior to us meeting with you. And I'll turn it over to Dr. Carter to see if he would like to close us out.
Yes, I just want to just say this is a great meeting. Thank you all for your input. And we, as we go forward, honestly, we have a lot of work to do. But before we can even get to work, we've got a lot of strategic thinking to do. And this meeting aids in our strategic thinking so that we can actually have a plan to go forward when we do care coordination and build sustainable systems. So thank you all so much for coming. We look forward to our next meeting, and I hope you all have a great day.
Thanks, everybody.